let's talk about blood sugar, why it's important to manage, how we can go about testing that, and what range we want to keep that.
Well, I would recommend that people first get a finger stick monitor or a blood sugar monitor from Levels Health if you need it. I'm wearing a blood sugar monitor right now, and I'm like kind of curious where my blood sugar is at right now. I'm like, where is it at? And it's around 92, and that's pretty good given that I ate about an hour ago. Wearing a blood sugar monitor is going to tell you a few things. First is, what's your morning blood sugar look like? What does your fasting blood sugar look like? Your fasting blood sugar is a marker of your liver's insulin sensitivity. So how well your liver's functioning overnight. And then on top of that, you have your post-meal blood sugar. So I guess before I should go on to post-meal blood sugar, let's talk about your fasting blood sugar ranges. Good is less than 100. Bad is greater than 100. Better is less than 95 to 90. Best would be like kind of like around 80 to 85. So like good is basically less than 100. Better is less than 90. And then, or less than like 95. And then like less than 85 is probably best. So you don't want to get super low, like 60s or so. Like that can be problematic for brain function. If you're really dropping really low in the middle of the night and you're not on a low carb diet, it could be because of low cortisol. So that could be a problem for people. It's just not being able to maintain a healthy blood sugar. But if you're regularly above 100, like it's oftentimes a sign of stress too. So you just having a higher blood sugar temporarily can be a stress signal. And then post-meal blood sugar is ideally less than 140. And that's where prediabetes sort of begins, is greater than 140. But then ideally, you want it kind of like less than 120 because that's optimal according to the American Academy of Clinical Endocrinologists. But in hunters and gatherer tribes, they don't really go above 110 because they're moving their bodies all day long. So that would be really, really optimal, but that's really hard to do in modern lifestyle. And then glycemic variability. The more noisy that your curve is, the more that you are going to struggle with like stress. Typically, it's usually in eating too often, snacking too much, that can cause glycemic variability.
And you mentioned the piece there about the hunter-gatherers and how moving helps regulate that. So an important hack we can share with the audience is the fact that after a meal, especially if you're indulging in a little bit more carbs than usual, a way to hack that and keep the blood sugar lower is to go for even a 10, 15-minute walk after the meal.
Yeah. And also like drinking a little bit of vinegar water before meals, that can help too. Just adding some vinegar to your meal. Pretty simple stuff.
Another one you mentioned in the book too, we'll add to the list here, is having your non-starchy veg first, then protein, and then having your starch at the end of the meal. So order of the meal can have an impact as well.
Meal order, meal timing is really key.
And for somebody who is totally new to this, they haven't measured their blood glucose, and now they're intrigued and they're thinking, okay, I don't even have any clue where mine's been all my life. What are some of the things people would notice if it's, going way out of the normal range? Obviously, if it's long-term, that would be diabetic, pre-diabetic.
Sure.
But for somebody who is relatively metabolically healthy, but they're having higher carbs, acutely, what are some of the things they'll feel if they're pushing that limit?
You can notice mood swings. Just like your energy levels will fluctuate highly. Getting tired after lunch. More acne is a good sign of blood sugar spikes. Too high blood sugar in general can cause more acne. And then on top of that, focus issues can be an issue for people. And what else? The big one is just not being able to go a few hours without eating, like your body constantly having to be eating in order to function.
One of the things I really enjoyed in your book was where you talked about not eating again for somebody who is measuring their blood sugar until it comes back down to 85 again, which for somebody who is, typically snacking a lot and not really managing their blood sugar at this point, that can be a good baseline for people to really feel what hunger feels like.
Yeah.
Instead of, just giving into cravings and snacking throughout the day.
Totally. I mean, it's so easy to snack all day long, especially when we're stressed. We're like snack. But really learning to like sit with the feeling of hunger and be like, okay, cool. I can feel this. I'm not going to die, you know? And even just like looking at your body and being like, where is my blood sugar right now? Like, do I really need to eat right now? And waiting till you're like 85 milligrams per deciliter or below can make a big difference in whether or not you're really hungry. Like, most people don't know what real hunger is, and they're habituating to social cues instead of actual hunger.
If you enjoyed that clip, press here for the full episode. I'll see you over there.
So if you have issues with anxiety, depression, focus, you probably have some energy issues that you're not even looking at. I feel that human connection is like one of the most nourishing things for optimal metabolic health. It really creates the conditions where you